Hello friends, welcome to NiftyHMS. NiftyHMS provides you electronic medical record for different specialties like veterinarians, dentists, general practices, or cardiologists, or Ayurvedic. So it provides different specialty doctors to make sure that patient assessment is done professionally. So today we are going to see how an ophthalmologist can do the patient assessment in NiftyHMS. So let's just check it out. So once you log in into NiftyHMS, you will see the dashboard, and from the left side menu, you will have the general assessment from the settings that you can check it out. And there we have ophthalmologist assessment. You can customize that assessment. So this is a system default assessment that we have. So you can, complain, then you have ophthalmology design, means the left eye and right eye, then there is a treatment. So these are different assessment sections that you can put it up, like prescription, if you want to assign some instrument while you are doing the assessment, checking or inspecting the eye condition. So the section, so on the left side menu section, module and fields, this is how you customize the assessment form. There is already assessment form that is predefined in the system. You can use it, but it gives you the option to customize this assessment form and make it your personalized version of the assessment form. So that's the ophthalmologist assessment template that system provides you directly. And for any particular doctor that is ophthalmologist or eye surgeon, you can change the specialty to ophthalmologist so that they can be seen as ophthalmologist, because it will automatically activate this particular assessment that we just seen in the system. So this is a doctor who is eye specialist or ophthalmologist, right? And whenever a patient takes appointment with this doctor, it automatically loads the ophthalmologist assessment for this particular patient. So we're just gonna go and try for one patient. So let's say Bendial Joseph is a patient who has taken appointment with us, and as eye specialist, Dr. Anand will do the assessment. So we're just gonna click on add assessment. Select doctor, and then the encounter ID is automatically selected there, so we don't have to do anything there. And we will write the complaint. The patient might be having a blur vision, or they might be having a pain or some sort of rashes or something like that in the eye. So we can select the left eye or right eye, and it opens up the pop-up, right, and it shows you different eye sections that you can write down the problems and things like that. And then once you're done, you just click on save button, and it generates. So we selected the left eye, so it generates the issues that's there in the left eye. And similarly, you can also do the right eye as well. So just click on right eye, and then it opens the pop-up, select the options, make some comments, and then shows you. So there is a left eye and the right eye. I think it shows you in the chart, as you can see on the screen. And if you click on eye symbol, it shows you the details of it. And then you can also prescribe a treatment or undergo a treatment as well. You can also prescribe a medicine, and all the details, when to take, where to take, and how many days, and things like that. You can also upload a written prescription. Sometimes doctors are not comfortable with online mode. They can write a prescription and upload the written prescription over here. The instruments are useful if you want to do some sort of inspection of the eye using that. And once you are done, you can just save this assessment. So this particular patient has been assessed with the assessment template that we created in the customized assessment form. So this is how it looks like. And once it's done, you can just click on eye icon on the list, and shows the assessment, this assessment with all the problems in the left eye, right eye. And then it gives you the detail, treatment, prescription, which you can print as well. So this is good for record keeping as well. So you can print it in the printer, and you can hand it over to a patient, or you can keep it for yourself, depending on how you practice medicine. Thanks for watching the video, and do subscribe to our channel. Thank you.